In this video, we are going to talk about a condition called leukemia, or commonly known as blood cancer in children. Cancer in children itself is a rare situation. Among the childhood cancers, leukemia is the most commonest. Almost 1/3 of all childhood cancer is because of leukemia. What is leukemia? Leukemia is a cancer arising from the blood cells, particularly the early precursors or primitive blood cells. It generally arises from the bone marrow. Bone marrow is the soft material within the bone. You can consider that as a factory which makes the cells in the blood. The blood contains red blood cells, white cells and platelets. They are all continuously made by the bone marrow. Because in the blood, these cells live for a certain amount of time and then they will die. So if your blood numbers have to be maintained, these cells has to be continuously be produced in the bone marrow. These early precursor cells within the bone marrow, when they start dividing out of control, that is when leukemia happens. Why they start dividing out of control? That is because of some mistake in the genes which has happened, which normally control the cell multiplication. Usually it is not one mistake, it is more than one mistake which has happened in the critical genes which control the cell multiplication. And once the leukemia starts, those cells keep dividing and almost fill up the entire bone marrow space. Because of that reason, the normal cells are not able to come out. One of the first question which comes to the parent's mind when their child develop leukemia is that, did I do something wrong? Why did my child develop leukemia? Unfortunately, most of the time, there isn't anything you could have done differently. It is just bad luck. There are some factors which are thought to be increase the risk of leukemia, but in almost about 90 to 95% of the children, there is no specific reason we could find out why this particular patients develop leukemia. We all have or will be having some mistakes in our genes. Lucky for us, these mistakes are in a place where that is not causing major problem. If the same mistakes have happened in the genes which are important to control the cell multiplication, we may end up with a cancer. So how do these children present at the time of diagnosis? As I mentioned earlier, because the cancer cells are filling up the space, sometimes the blood counts of the other normal cells like red cells, white cells and platelets may be very low. So this may have been picked up when doctors have done some investigations for some other condition or to investigate a fever. When the red cells go down, the patient will become pale, what we call as an anemia. They may feel very tired. When the platelets go down, there may be spontaneous bleeding. So there can be bleeding under the skin, or there can be sort of bleeding from the mouth or nose. And when the white cell count goes down, they become more prone for infections. And because of that, they may have fever, mouth ulcers, and other problems. Sometimes when the leukemia fills up the bone marrow space and then it spills over into the blood, you will be able to see these abnormal cells in the blood tests as well. And there is one particular test called peripheral smear where you can actually look at these abnormal cells, what we call as blasts. And because it is involving the bone marrow, these patients also may have ongoing joint pains, joint swelling, which is not resolving with simple medications. And some of the other symptoms which the parents may notice is that ongoing fevers which are not resolving, or swelling of these small, what we call as lymph nodes or lymph glands, which are present all over the body. And there may be loss of appetite and there may be loss of weight as well. Or in general, the child who was very energetic and active suddenly is not as well as before. Sometimes they can also have headache and vomiting. So even in leukemia, there are more than one types. In children, what we call as an acute leukemia, which starts very quickly, there are two main types. One we call it as an acute lymphoblastic leukemia and another one called as acute myeloid leukemia. They are two different cancers which look similar overall, but they are different because of the cell of origin. The one type arises from particular type of cells called lymphocytes, and the other one arises from other cells which belong to the myeloid series. The treatment is slightly different and the outcomes is also slightly different. Other than that, there is another much rarer type of cancer called chronic myeloid leukemia, which can happen in children. That may form about 5% of all leukemias in children. That has a different type of treatment as well. How does the leukemia gets diagnosed? You may already be suspecting leukemia from the earlier blood results and looking at these cells in the blood, which is called as a peripheral smear. But to confirm the diagnosis, most of the time we have to look at the bone marrow, which is the factory of the cell production. We do a special test called bone marrow aspiration study, where most of the time we give a little anesthesia to make the child sleep, and we put a small needle in the back pelvic bone to take some bone marrow, which will almost come like a fluid, and it will be looked under microscope, and special tests are done on it to find out whether this is leukemia or not. Most of the time this test is more or less clear cut in making the diagnosis. In addition, we may do some other tests, including collecting some fluid around the brain by putting a needle in the back, what we call as a CSF analysis, to make sure it has not spread to the area around the brain. And from the bone marrow sample, we will send for various investigations to look at the surface markers on these abnormal cells to categorize the type of leukemia, called flow cytometry. And also we will do some genetic testing to find out what exact type of mistakes were there in this leukemia cells. Once the diagnosis of leukemia is confirmed, your doctor will explain to you what type of leukemia this is and what treatment it is going to involve. Lot of the parents ask the question what stage it is. But in leukemia, because it is a cancer of the blood and the blood goes around all over the body, right from the start it is all over the body. So it is the stage, as you would consider in other cancers, is not applicable to leukemia. More than the stage, it is the age of the patient, the white cell count at the time of diagnosis, and what type of mistakes that were present, and how quickly the patient responds to the treatment. These are the important factors deciding which patient is going to do well and who may not do that well. So the treatment for leukemia mainly involves chemotherapy. Chemotherapy are medicines which will attack the cancer cells, and usually it comes in sort of what we call as a courses. So at the starting of the treatment, the immediate aim is to get rid of the cancer as quickly as possible to undetectable levels, and that is what we call as an induction. The treatment will vary slightly based on whether it is a lymphoblastic leukemia or myeloblastic leukemia. In myeloblastic leukemia, the treatment is very intensive and very strong chemotherapy, so the patient almost will spend the entire time in the hospital, because following the chemotherapy their counts will be very low, they have a very high risk of infection, and they may have to stay a long time in the hospital till their counts pick up, and then as soon as the count picks up they will start the next course. But the treatment duration overall is shorter. Whereas in acute lymphoblastic leukemia, the treatment is slightly less intensive compared to the acute myeloid leukemia, but the first 6 months are going to be intensive. After that they will have a long period of what we call as a maintenance treatment, which is a low intensive treatment which will go on for 2 to 3 years. The chemotherapy will involve a few different medications put together in combination to attack the leukemic cells, and with each course we expect the leukemia to go down further and further to go to an undetectable levels. In leukemia treatment, there is one important investigation, what we call as a MRD or minimal residual disease, which is particularly very important in acute lymphoblastic leukemia. That tells you how much leukemia is left behind after a course of chemotherapy, especially the first course of chemotherapy. That kind of decides how well this patient is going to do, and if it is not completely undetectable by the end of the first course, we may have to increase the treatment. In terms of side effects of the treatment, depending on the medications that are used, there may be suppression of the bone marrow, for which you may have to need blood and platelet support, infections for which the child may have to get admitted and treated with antibiotics, and mouth ulcers, vomiting. These are some of the common side effects. So the aim of the treatment is to give as much treatment as possible with minimum side effects, so that you are able to clear the leukemia without causing any major damage to the patient. But that is more difficult in practice. So all patients will undergo some degree of side effects. The degree may vary between the patients, but the aim is to get rid of the leukemia completely so that it doesn't come back at the end of the treatment or during the treatment. So with the modern treatment, majority of the patients with leukemia get cured with chemotherapy alone. There may be a small percentage of the patients whose cancer response to treatment is not good enough, and we know from our previous experience that these patients may relapse, that is, the leukemia will come back if you don't do anything different. So a proportion of these patients may need what we call as a bone marrow transplant, where we will have to remove the patient's own bone marrow and give bone marrow from somebody else in order to get rid of the leukemia. So that will be the last option when the common treatment does not work. I hope this video was useful. If you need further information or clarifications, kindly consult with your pediatric oncologist. Thank you.